Welcome to The Explainer. Our whole goal here is to take complicated topics and make them super clear and useful. And today, we're diving into something that touches a lot of pregnancies, but yeah, it's often pretty misunderstood.
All right, let's just jump right in with a number that might surprise you. Up to 10%. That's right, up to 10% of pregnancies in the US are affected by a kind of diabetes that shows up after you get pregnant. I mean, that's not a small number, right? And really, getting a handle on what that means is the very first step to making sure everything goes smoothly.
So, today we are going to demystify all of this. We're going to take all those medical facts and turn them into a plan that feels empowering, something you can actually manage. So let's get into it. Starting with, what are we even talking about here?
Okay, first things first. It's really important to get that not all diabetes during pregnancy is the same thing. So let's break down the different types you might hear about.
So the one you hear about most often, that's gestational diabetes, or GDM for short. Basically what happens is the hormones from the placenta, which is, doing its job supporting the baby, start messing with your body's insulin. They kind of get in the way, making it harder for your body to use insulin like it normally does. The result? Your blood sugar goes up. The key thing here is that it's a temporary thing, directly caused by the pregnancy itself.
And this chart really lays it out perfectly. See, the biggest difference is all about timing. If you have type 1 or type 2 diabetes, that's a condition you already had and you're just managing it through your pregnancy. But gestational diabetes, that's different. The pregnancy itself is what kicks it off. It develops because you're pregnant.
All right, so now we know what it is. The next logical question is, so what? Why is it such a big deal? Let's talk about the risks, because understanding them is really what drives home why managing this is so important for both you and your baby. So why is this considered a high-risk condition? And look, the point here is not to scare anyone, not at all. It's about being informed, right? It's about understanding what we're working with so we can be proactive. Because when blood sugar levels are consistently too high, it can create some real challenges. For the mom-to-be, these risks are all connected. For instance, if blood sugar isn't managed, the baby can grow larger than average, and that can increase the chances you'll need a C-section. It can also lead to something called preeclampsia. That's seriously high blood pressure during pregnancy. And it's also kind of like a preview. It significantly increases the likelihood of developing type 2 diabetes down the road.
And for the baby, well, the risks are closely related. Think about it. That extra sugar in your blood, it crosses the placenta to the baby. So the baby gets more sugar than it needs, which can cause that higher birth weight we just talked about. Then, right after birth, the baby's body is still in overdrive, producing a bunch of insulin to deal with all that sugar. But now the sugar supply is gone, and all that extra insulin can cause their blood sugar to crash. You can see how this whole chain reaction just really underlines why having a solid management plan is just non-negotiable.
Okay, but enough about the risks. Let's get to the most important part, the playbook, the what do we do about it part. Because this is not just some diagnosis you have to live with. Nope, it is a call to action. And here's your game plan for taking control and having a super healthy pregnancy.
And really, this image sums it up beautifully. The whole idea behind managing this is balance. It's like a three-legged stool. You've got your diet, you've got monitoring your blood sugar, and you've got checking in on the fetus. It's this combination of daily actions that keeps everything stable and healthy.
So let's break that down into 4 simple, totally doable steps. 1, you're going to monitor your blood sugar with a little glucose meter at home. 2, you'll follow a healthy eating plan. We're talking a good mix of proteins, carbs, and fats. 3, get moving. Even a walk after meals makes a huge difference. And 4, if you need it, you'll take medication, like insulin, to help keep those numbers in the right spot.
And when we say monitor, what does that really mean? It means hitting these target numbers. This is what you're aiming for. You'll check your levels first thing in the morning. That's your fasting number. And then again an hour or two after you eat. These numbers are like your daily report card. They tell you and your healthcare team exactly how well your plan is working. Now, everyone's journey with this is a little different. Your plan is going to be tailored just for you. For a lot of people, just focusing on diet and exercise is enough to keep those numbers in check. That's sometimes called A1-GDM. But for others, that's not quite enough, and that is perfectly okay. That's when your doctor might add medication, like insulin. That's A2-GDM. And a quick note on insulin, it's a super common and safe choice because it does its job without crossing the placenta to the baby.
Okay, so you've managed it through pregnancy, and your beautiful baby has arrived. But the journey isn't quite over. There are a few really important next steps to think about for your own long-term health.
This is probably the #1 question people ask. Does it just go away after the baby's born? And the answer is yes. For most people, it absolutely does. Once a placenta is delivered, those hormone levels start to go back to normal, and so does your blood sugar. But there's a little more to the story.
So while your blood sugar will likely go back to normal pretty quickly, it's really important to get tested a few months after delivery just to make sure. And here's the but we just mentioned. Having had gestational diabetes means your risk for developing type 2 diabetes later is higher, so you'll want to keep getting tested every 1 to 3 years. It's just a smart way to stay on top of your health.
And that is why that follow-up testing is so critical. Because look at this number, about 50%. Half of all people who've had gestational diabetes will eventually develop type 2 diabetes. Now, that's a big number for sure. But here's the thing. It is not your destiny. It's a heads up.
In fact, you can look at this increased risk as an opportunity. It's a powerful motivator to really focus on your long-term health. And the best part? You already know how to do it. Those exact same healthy habits you worked on during pregnancy, eating well, getting active, are the absolute best tools you have to lower that risk and prevent type 2 diabetes.
Okay, so we've covered a lot of ground. What it is, the risks, the plan, what happens after. So what's the big takeaway here? What's the one thing you should walk away with?
It's this right here. The main message is all about empowerment. Getting this diagnosis can feel really heavy, I know. But gestational diabetes is a manageable condition. You are 100% equipped to handle this. With the right plan, with the right support, you can and you will have a healthy pregnancy and a healthy baby, period.
So we'll leave you with this one last question to think about. What's one small step you can take today for a healthier future? It doesn't matter if you're planning a family, if you're expecting right now, or if you're just here supporting someone you love. What's one tiny thing you can do? Maybe it's just taking a walk after dinner tonight. Maybe it's adding one more vegetable to your plate. Because every single one of those small steps adds up to a much healthier future.